Are you considering breast reconstruction with your mastectomy for breast cancer? We will teach you all about it. If you're going to have a mastectomy for your breast cancer, you have an important decision to make. Do I have plastic surgical breast reconstruction or do I not? Remember, first of all, the most important goal is to treat your cancer effectively. But breast reconstruction, when you have a mastectomy by a plastic surgeon, working together as a team with your breast cancer surgeon, is so important to learn about in order for you to make the very best treatment decisions for your unique breast cancer situation. In this lesson, I'm going to go over the different mastectomy surgical options and how breast reconstruction plays a role in your choices for having a mastectomy. I'm going to review with you why treating your breast cancer comes first when you're making decisions with your breast surgeon. I'm going to share with you the important role that plastic surgeons play a role in a breast cancer team, and also go over the different breast reconstruction options available today. And I'm also going to go over somewhat surgery on one side, a mastectomy on one side with reconstruction, versus a mastectomy on both sides with or without reconstruction. So let's get started. So how does a mastectomy for breast cancer and breast reconstruction work together? Well, a mastectomy, let me go over this first. A mastectomy, the goal of a mastectomy is to remove the breast tissue. And really, the way to think about it is we're removing the fatty tissue of the breast and preserving the skin of the breast. So, a simple mastectomy, which means a mastectomy without reconstruction, is where your breast cancer surgeon removes the tissue of the breast and does not reconstruct that. And it does leave you without a breast, flat, and generally an incision across your chest, no nipple and areola. So, but more than 50% of women who undergo a mastectomy undergo breast reconstruction. And that is done as a team with your breast cancer surgeon and a plastic and reconstructive surgeon. So let me explain about reconstruction. The goal of breast reconstruction is to recreate the shape of the breast. Makes sense. So your breast surgeon typically comes in and removes the breast tissue, leaving as much skin behind as possible, and even sometimes the nipple and the areola. And the breast surgeon begins a process, generally best done when you're undergoing your mastectomy, to start the reconstruction process. That's called immediate breast reconstruction. So the surgeon does a mastectomy, removes the cancer, probably checks some lymph nodes, and the breast reconstruction plastic surgeon comes in while you're asleep and begins to reconstruct your breast. Starts that process by recreating the breast with either a prosthesis or using your own tissue. So, a simple mastectomy, no reconstruction, versus a mastectomy with reconstruction. A mastectomy with reconstruction is a bigger surgery. There's more recovery. But the decision process to have reconstruction in many ways is a personal one. And the more you know, the better decisions you'll make with your breast cancer team. Next, I'm going to talk about how treating your cancer comes first in all of these decisions. With breast reconstruction, treating your breast cancer comes first. And whether or not you need, or your breast surgeon tells you that you need to have a mastectomy for your breast cancer, or you choose to, is a complex decision process, which we'll cover elsewhere at the Breast Cancer School for patients. But let me give you some examples of where a particular cancer situation can change your decisions about a mastectomy and or reconstruction. One of the most common situations is when someone has an inflammatory breast cancer. It's about 5% of all breast cancers, and that's when a cancer is rapidly growing, typically involving or making changes in the skin. And it's one that we immediately jump on and start chemotherapy as soon as possible. You need a mastectomy if you have inflammatory breast cancer after chemotherapy. And typically we do not begin a reconstructive process at the time of that mastectomy. Some do, and some feel comfortable with doing so in a few situations, but generally no. One of the reasons we don't want to put an implant in, or we don't want to put your own tissue there, it delays you getting to radiation to the area of the mastectomy, called post-mastectomy radiation therapy. So that's one complex decision process. Another one, your tumor is behind the nipple. So you want to have a mastectomy, or you need a mastectomy, and you want a nipple-sparing mastectomy where it preserves the nipple and areola, reconstruct, and it really gives you an excellent cosmetic result in some women. But if your tumor is behind the nipple and the areola are too close to it, we just simply, from a cancer perspective, cannot leave the nipple and the areola. We'll take too much chance of leaving behind cancer cells that can grow in the future and threaten you. Another situation is chemotherapy. More and more these days we're giving chemotherapy up front before surgery. And that delays the timing of surgery, but doesn't necessarily change your options for breast reconstruction. All of these complex decision processes is the reason why we created the Breast Cancer School for Patients. We want you to be an expert and your own best advocate so you can make good treatment decisions. And some of them are simple, some of them are quite complex. A plastic and reconstructive surgeon is an important part of a breast cancer team. Let me give you some ideas. A plastic surgeon who spends a great deal of time doing breast reconstruction for cancer has a different approach to patients than someone that just simply does cosmetic surgery. They're interested in the cancer treatment, they know the cancer treatment, and more importantly, they work together as a team with your breast cancer surgeon, knowing how to make decisions to not only best treat your cancer, but also get the best cosmetic outcomes in this cancer situation. So, when your breast surgeon is discussing with you that you need a mastectomy or you're choosing to have a mastectomy, they generally work closely with one or two other breast reconstruction surgeons. And they will typically refer you to the person that they partner with the most and work together the best with to get both a good cancer outcome and cosmetic outcome. And a good plastic and reconstructive surgeon participates in a breast center and in that team atmosphere, because there are times where a plastic surgeon must make decisions, let's say whether to use an implant or use tissue, a flap, which is a bigger surgery. But if they're communicating with your breast surgeon, and it's sometimes with the medical oncologist, more importantly the radiation oncologist, sometimes a patient needs radiation after a mastectomy. And that really can change a flap and shrink a flap, whereas an implant would be a better choice in some situations. These are complex decisions, and that's why work together with your plastic surgeon and breast surgeon and make sure that you three are working together as a team to make the best choices for you. So what are my plastic surgical reconstruction options if I'm going to have a mastectomy? I want to go over the two different approaches that plastic surgeons typically use to reconstruct the breast in concert with a breast cancer surgeon. The most commonly used approach is reconstructing the breast with prosthesis, an expander or an implant, or a combination of the two. That's done in about 90% of breast reconstructions. The other option, done in about 10%, are flat reconstructions, where you use your own tissue from a different part of the body, bring it in, and reconstruct the breast underneath the skin after a mastectomy. Let me talk about prosthesis first. The most common. There are two approaches. The most common of these two prosthesis reconstruction approaches is a two-stage procedure. So let me walk you through the timeline. In advance, you and your surgeon are planning a mastectomy and reconstruction. You visit with a plastic surgeon, typically 1 or 2 times before your surgery. The day of surgery comes. Your breast surgeon removes the breast tissue, keeps the skin of the breast. And then your plastic surgeon comes in and does the first stage, which typically is placing an expander, a prosthesis that generally is pretty firm and is expandable underneath the skin to recreate the round shape of the breast and sometimes stretch out the skin of the breast. Typically then you get your drains out and then finish your cancer treatment, and then months later you come back for stage number 2, two-stage, where you take out this expander and you move things around and you place typically a final soft implant to reconstruct the breast. Oftentimes you need surgery on the other side to augment, to match, or to do a lift or a reduction. And some women have mastectomies on both sides and reconstruction on both sides. So that's a two-stage breast cancer reconstruction. A one-stage is a little simpler, and it's not available or appropriate in most, but it's possible in that your breast plastic surgeon comes in after the mastectomy is done, same day of surgery, and places a final soft implant to reconstruct your breast. And then once you get your drains out, there's a good chance you don't need a second surgery, so you can save a second surgery. It's not appropriate in everyone, and not all plastic surgeons embrace this approach, but it's sometimes an option. So that is prosthetic breast reconstruction. Flat reconstruction, 10%, is a big surgery, and it has some advantages and disadvantages. It typically moves fatty tissue from your lower abdomen or behind your arm up to reconstruct the breast. It's a bigger surgery, a longer recovery, but if done well and successful, it can be a very permanent reconstruction of your breast, and you typically don't need any other surgeries in the future to replace an implant or if it leaks or ruptures. So, two different breast reconstruction options by a plastic surgeon working together as a team with your breast cancer surgeon. What are the advantages and disadvantages of having a mastectomy on one side versus both sides when putting breast reconstruction into the mix in the decision process? I encourage you to take our free video lesson at the Breast Cancer School for Patients on mastectomy, one side or both. We covered in great detail. But some women, based on the size and the shape of their breast, in addition to their cancer situation, choose to have mastectomies on both sides and immediate reconstruction. There's some disadvantages, obviously, of removing a breast that doesn't have cancer. But there's some reconstruction advantages, and it's important to mention these rather than gloss over them. If you're having a mastectomy on one side and not planning to do anything on the other side, and keep the breast for a cancer on one side, invariably, in a majority of situations, once you reconstruct your breast after the mastectomy, it is a different size and shape as the other breast because it's hard for us to give you your unique size and shape of your breast. Everyone's different. So oftentimes you have an expander placed and then you come back a second surgery, two-stage surgery, and you typically have a reduction if you're larger or an augmentation if you're smaller to do your best to create symmetry on both sides. So invariably you do need surgery on both sides. Some women choose, if they're going to have surgery on the other side, to go ahead and have a mastectomy on the other side for their own reasons. Maybe they carry the breast cancer gene, or they're really worried about having a cancer on the other side. Removing the other side in most situations does not make you live longer, but it is a difficult personal choice, and a lot of women give it thought. So in that situation, you can have a mastectomy on both sides, do the same breast cancer surgery, reconstruct both breasts in the exact same fashion with same expanders or same implants, and you have a better chance of walking out with good symmetry. A lot of downsides. When you have complications from a mastectomy and reconstruction, it is miserable. As I tell patients, it's a disaster. And it kind of can happen in 5 to 10% of patients. And it changes everything. So these are surgeries that carry some risk. There's no sensation or minimal sensation after you have a reconstruction over the skin of the breast, reconstruction. So it's a very serious, complex decision process that you must spend time engaging your breast cancer surgeon. And if you're unsure about getting reconstruction, have them refer you to a plastic surgeon to learn more, because the decision you make is so important. You have to live with it for so many years to come. Breast reconstruction by a plastic reconstructive surgeon working as a team with your breast cancer surgeon is an essential option for women who are facing a mastectomy for breast cancer. Remember, treating your breast cancer comes first, and these treatments can either expand or limit your reconstruction options. Always make sure that if you need a mastectomy or choosing to have a mastectomy, that you have a detailed discussion with your breast surgeon about reconstruction options. Only when you are well informed about all of your options will you make the best decision for your unique breast cancer situation. To learn more about breast reconstruction for breast cancer, visit the Breast Cancer School for Patients, where we actually teach you everything you need to know. We're here to help you get the best possible breast cancer care in your community. Register on our website to get our list of questions to prepare you for your next doctor visit.